on the surface of it, it seems reasonable that doctors and other prescribers of medication and other treatments should tell patients everything that's possible that could happen in a negative way. That seems, in a way, kind of logical, but it turns out to not be a very good idea for a couple of big reasons. One, when you share every possible potential side effect with a patient before prescribing, it has been shown that interaction actually leads to more side effects. So even though we physicians have the responsibility to not harm people, here we are sharing this honest information leading to harm. So that's one issue. Another is that in our field, in headache medicine, compliance with instructions and adherence to treatment are not good. They are traditionally poorer than in other subspecialties of neurology and in other fields. So telling patients about every single potential side effect to a treatment, again, has been shown to lead to less compliance, less adherence. Once again, actually doing the opposite of what you think you're doing by being honest, which is to prevent improvement in their health condition. And philosophically, when you think about sharing potential side effects, because of this imperative to be honest with your patient, is it really being honest? This idea that sharing all potential side effects is some sort of ultimate truth is actually not correct. It's a version of the truth that really doesn't exist because those side effects have not happened yet. And so my thesis for this debate is that it is really important for providers, for prescribers to do two things. One, to share common expected side effects about treatments with patients. And two, to be very aware of all potential side effects so that the treatment can be tailored to an individual patient. So for example, let's say a medication has a very, very rare potential for causing kidney stones. And this patient has a history of kidney stones. Well, you may not share that information because you won't prescribe that medication. Or if you do, then you must share that information. Now, another patient who has no risk factors for kidney stones, you may not want to share it. You may want to downplay it. You may want to continue to prescribe. So that is a summary, but I'm happy to answer any other questions about this area that I think is really a very a good example of applying practical medical ethics to the practice of medicine.